This is often a very subtle kind of epilepsy and it is missed by parents. They actually present with mild jerky movements of the hands or the shoulders, and especially these occur in clusters, that is while awakening up from sleep. And they occur in clusters throughout the day, especially during when a child goes on to feel drowsy and goes on to go to sleep or comes off from sleep. His normal activity reduces, his playing, his interaction with parents, that decreases all. Treatment is absolutely different from the other normal epilepsies. A very good morning. I'm Dr. Arundhati Banerjee, consultant pediatric neurologist associated with Neotia Bhagirathi Hospitals, Newtown. And today, on the occasion of National Epilepsy Day, I would like to stress on a particular special type of epilepsy, which is very common, which is not so uncommon actually, in the infancy, which is called epileptic spasms. So this is why I want to highlight is this is often a very subtle kind of epilepsy and it is missed by parents. So the awareness is very essential in order to catch these patients early so that we can institute treatment early. So how do they present? They actually present with mild jerky movements of the hands or the shoulders, and especially these occur in clusters, that is while awakening up from sleep. And they occur in clusters throughout the day, especially during when a child goes on to feel drowsy and goes on to go to sleep or comes off from sleep. So during the sleep-wake cycle, these are particularly observed. And it is often accompanied by some crying movements. And then what happens? Why are the patient or parents distressed? Because with these movements, what they notice is that their child does not behave normally. His normal activity reduces, his playing, his interaction with parents, that decreases all. So that is what brings these parents to us. And why is it important to pick it early? Because the earlier you institute treatment, the better will be the neurodevelopmental outcome. So diagnosis is essentially, it is a clinical diagnosis. That is, we always ask the parents to make home videos, and then because it often can be missed. So whatever peculiarities they get in their children, if they make it in the form of a home video, that will help a pediatric neurologist to identify it early. Earlier, as I said earlier, we treat. The other is the treatment is absolutely different from the other normal epilepsies. So what is the line of treatment? Actually, we essentially need to admit these kids, because it is, even though it looks very mild and very subtle, but actually it has far-reaching effects. It has graver effects than what it appears from the outside. So, and it is often picked up by EEG or electroencephalogram, which is a specialized test we conduct on these kids, in which abnormal waves in the form of hypsarrhythmia, which is a particular pattern which is picked up on the EEG, is seen in most of the times. And why we need to admit them? Because the treatment is absolutely essential and absolutely necessary and quite different from normal epilepsies, because here we have to give injectable steroids or even oral steroids, which is different, which we do not use in other epilepsies. The other treatment modalities are vigabatrin and ketogenic diet, and some of the oral drugs are also effective in this type of epilepsy. So the reason we need to have awareness regarding this is that the earlier we pick up, the better will be the neurodevelopmental prognosis, and the child will have a near normal life. Whereas if this child continues to seize, then it can be difficult to treat and the child may not come to the pre-morbid state again. So with that, I would like to end my session and thank you.